Thank you for that introduction. I don't have any relevant disclosures to this talk, but I will say that this is a topic I am very passionate about because 95% of the time, I absolutely love my job. That small percentage of the time when I don't is usually related to managing surgical complications or dealing with negative patient interactions. The angry patient, aggressive patient, the patient that says or does inappropriate things with me and my staff. So this is an extreme example of that negative or inappropriate patient behavior. So 65, that's the number of healthcare providers that died in 2022 as a direct result of workplace violence. A few examples of that. So Dr. Ronald Gilbert, who founded Promescent, was killed in 2013 by a patient who was upset about post-operative urinary incontinence and erectile dysfunction, about a surgery he had undergone 20 years prior. Dr. Gilbert wasn't even the surgeon that did his surgery, but was a resident who had recommended it to him when he was at the VA. Dr. Charles Goldonian, who was a urologist in Nevada, was killed by a patient who was upset about chronic post-vasectomy pain. In 2020, a patient's son who was upset about his father's appointment shot their patient services rep, who's shown here, at a New Jersey urology office. And even in our state of Minnesota, there was a shooting in 2021. He shot 4 individuals at a healthcare facility, killing one of them. He was upset about not receiving prescription pain medications, which he'd become addicted to after back surgery years prior. This particular individual had threatened that clinic multiple times in the past, and at one point they had filed a restraining order against him. So while these are extreme examples, 62% of us report being threatened by a patient, and nearly a fourth of us report being physically assaulted by a patient. 4 years ago, our men's health team had a team retreat, which consisted of us physicians, our APPs, nursing staff, and then all of our administrative and supportive staff. And one of the issues that came out of our discussion were the 1% of patients who were dominating 80% of our time and energy in the clinic. Our nurses detailed some really horrific stories of things that they had been exposed to and were exposed to on a constant basis. And I think it was really an eye-opener for many of us on the team that they were putting up with this kind of behavior from patients, which is where the genesis of this talk comes from. So I'm going to talk to you about a 5-step process that I want you to think about the next time you have a patient that's out of line and that you need to set the boundaries with. So we're going to talk about recognizing what that behavior looks like, verbalizing it or addressing it with the patient, documenting it, setting the appropriate boundaries and delineating what the consequences will be, and then most importantly, the follow-through for that. As physicians, we're compassionate individuals. That's one of the things that drew us to this line of work. And at Mayo Clinic, it is ingrained in you from day one that the needs of the patient come first, which is why it's very tempting to let things slide when patients are inappropriate. We chalk it up to the fact that the patient is afraid, that they're frustrated with the process, perhaps they have poor health literacy or mental health issues. But choosing to ignore that kind of behavior really emboldens patients a lot of the time to escalate their behavior. So I'm going to give you a few examples that myself and my team have heard. So after offering the patient an appointment with nursing for ICI teaching, he says to me, "Do I get to pick which nurse?" So I'm thinking to myself, if he has the balls to say this to me, what is he going to say to the nurse who's in a room alone with this guy? Patient says to me, 65-year-old post-op IPP patient who says, "You're kind of sexy. Does your husband know how lucky he is?" So first reaction is I look around the room to see if there's a 60-year-old woman in the room that I missed coming in, but sure enough, he's talking to me. Patient, you're running an hour behind in clinic, and when you walk into the room, he's irate that he had to wait so long, and he's yelling and shouting profanity, and you can hear him in the hallway. Patient calls the office demanding to speak with you. He yells at your secretary when she tries to take a message, and then he calls in multiple times over the course of the day, demanding someone call him back immediately. Post-op IPP patient who's been having significant pain shows up without an appointment. He's pacing the waiting room, demanding a prescription for narcotics and demanding that someone see him immediately. That same patient then sends a message through the EMR that says, "It doesn't seem fair that I'm agonizing in pain while you're at home enjoying dinner with your family." What exactly is he implying with that comment? Which brings us to the next step, which is that you really have to speak up. It's very tempting to try and press onward and forward and ignore that behavior, but you need to be clear when the patient has crossed that line, and you need to be very specific about what the behavior was. It's like I said, especially in Minnesota, people are very nice. It's very tempting to try and just pacify them and go about the visit, but that really will embolden and empower the patients to continue that behavior. This is a face sheet. This is a sheet that every patient who comes into our practice gets when they're seated in the exam room. And after that, that team retreat that we had 4 years ago, we added this paragraph at the bottom. And it essentially says, "We ask that you respect the diversity of our staff and refrain from making any inappropriate comments." And we try to acknowledge that we understand that it can be embarrassing. Many of the subject matter that we deal with is very intimate, but that we have expectations from the patients as well. So here are some of the responses, common responses that I'll use with some of the comments that I get. "So I understand that talking about your sexual function can be embarrassing, but I'm going to ask you to refrain from making comments like that. I expect that you'll treat every member of my team with the same degree of respect that we've shown you. Look, you've had a really long day. I apologize for making you wait, but I want to be clear that for us to make the best use of our time together, I'm going to need you to stop yelling and swearing." For the patient who is calling in, "I understand that you called this morning demanding to speak with me while I was in surgery and that you were angry and rude to my staff. Every member of our team is working hard to take care of all of our patients, including you, and I need you to be courteous and professional to everyone on my team." How many of you heard this from an attending during training or say this to your trainees now? If you didn't document it, it didn't happen. This is really a critical step in the process, because documentation builds your case in the event that you're going to fire this patient from your practice, or in our case, from the institution. It also serves as a warning to the patient. They have access to their medical records, so they can see exactly how you documented the interaction that they had with you, and it serves as a reminder to them. But even more importantly, it's a warning to other providers. How many times have you read through a patient note and seen that they had some kind of negative interaction, right? It's written in doctor code about how you word it and how you say it, but you know it when you see it, that that's a warning to another provider that this could be a violent or aggressive patient. Depending on the kind of event that took place, our patients will also get a formal written letter that details exactly what the behavior looked like that occurred, and that will not be tolerated, and if it continues, that their care at Mayo Clinic would be terminated. So then it comes setting the boundaries. This is where you really have to outline what the consequences are. If you do this, then this happens, right? This is like any form of discipline for those of you that have children, right? You have to follow through and you have to set what the consequences are. If you don't lower your voice, we'll have to end the visit. If you make a sexual comment like that again, I'm going to ask you to leave. If you continue to send portal messages that are disrespectful, you may lose access to your portal altogether, which is something our institution also does. And then lastly, but likely most importantly, is the follow-through, right? You have to mean what you say and say what you mean. You have to be prepared to take that next step, and this is the point that you need to engage your administrative team early. And this, I would argue, says the most about you as a provider and sets the example to your team. If they know that you're all talk and you're not going to follow through, they're not going to come to you the next time an event like this occurs. So you need to define what that process looks like for your institution or for your clinic. Mayo Clinic has a lengthy policy like everything else at our institution, but they do have an excellent process for how to address this. This is a snapshot from our patient experience website. So depending on the type of infraction that occurred, what the next step is, and there's some formalized templates and guidance as to what you can do. So you should educate your team about what those resources are, and most importantly, if you take anything from this talk, I hope that it's that you open up the dialogue with your team, that you ask your nurses, your APPs, Does this ever happen to you? If so, can you give me some examples of what are the kind of things that you're experiencing when I'm not around? In summary, neither you or anyone on your team should be putting up with this kind of inappropriate behavior. So learn to recognize it, identify it, address it with the patient, document it, set that boundary, the consequences, and make sure that you follow through. Thank you.